All right, for the lower extremity, we do see there is clearly a huge difference between the humerus versus the femur, okay? So besides size, what is so prominent that you see? The head of the femur is like really identified on the femur versus the humerus, right? So this is still the head of the femur, and there is a dip in there that apparently I like to label on test day. There's a dip right there that has a ligament attached to it so that it sticks in the acetabulum and does not move. That dip is known as the Fovea Capitis. And just like the humerus had some bumps on the lateral side, it's the ones that you can kind of feel on your lateral side, but these are huge, right? Because it's a bigger bone and it's more weight that we have to carry from superior to inferior. So this is our greater trochanter, and over here is our lesser trochanter. So greater trochanter, lesser trochanter. Now we're going to come down to the distal femur. So at the distal side, same thing. Condyles, however, we have both condyles and epicondyles. It's a bigger bone. It's articulating with a lot of stuff down here. So the condyles are here. What is this one going to be? Medial. Medial. How'd you know that? Because it's on the head side. This will be your lateral condyle. Your epicondyles are the surfaces on the outer medial and lateral surface, kind of like on either sides of these. So this would be the medial epicondyle, lateral epicondyle. Okay? And that is it for the femur. There's a little bone somewhere in that box, and it's the patella, which is the kneecap that kind of sits right there on that surface. So the next one down is a tibia. Just the same sort of pattern that we did superiorly in the upper extremity with the humerus sitting in the scapula, and then we had two little bones connecting to our wrist and hand. We have a femur sitting together with a tibia and a fibula. It's a tiny fib, okay? So that's how you remember which one is which, because, boy, if I had $1 for every time I heard tibula and fibia. No. Fibula, tibia, and it's a tiny fib. So the smaller one is a fibula. And the fibula kind of sits like that. I'm not too sure that these are the same persons on the same side, but you get picture of it. And the tibia, nothing to it except for being able to identify it. And right here, there's a prominent bump called the tibial tuberosity. So here's the tibial tuberosity. And if I were to put my femur right on here, I would see that there was a surface on the tibia with the same name as the condyles. So this is the medial and lateral condyles of the tibia. So it's going to be important to write femur or tibia when we're talking about labeling medial and lateral condyles or epicondyles. You'll have to write the bone after it. Okay, so that's a part of it. I know we're almost done. In your body, in anatomical position, where is the tibia? So we're just picking sides, just like we did for the radius. Medial side. So this is always going to be called the medial malleolus because the tibia sits on the medial side. Now we're down by our ankle, aren't we? So you have a bump on the left on the inside and then a bump on the outside, right? So the tibia is always your inside bump, the medial side, called the medial malleolus, which is cool because the only thing you need to know on the fibula is this is the head, and this is the lateral malleolus. So the projection distally on the fibula will always be lateral malleolus. Does that make sense? And that's the fibula. So now let's get to the foot. So my little disclaimer on the foot is like, look at us. We're so tired. We've just rattled off everything from top to bottom, and then you forget about the foot. Don't, because it's easy. So just like we said, carpals, metacarpals, phalanges, we've just changed it to tarsals, metatarsals, but still phalanges. So if we're following that same pattern that we did in the upper extremity, how do you think we're counting?
From the big toe in. From the big toe.
From the big toe, which is known as, we don't call it that big toe. Thank you. From the hallux is first digit, second, third, fourth, fifth. In that fashion, same thing. Hallux is missing a middle phalange. So it's proximal, distal. And then all of them all have. Even the little tiny fifth digit has a middle, proximal, and distal. Okay, so these are our metatarsals. I'll tell you right now, come lab practical time, sometimes we forget if we're looking at a foot or hand, or you just, attention to detail, so you write metacarpal. Can I even give you half credit for that? No, because you've cut off the wrong body part. So, so here are the tarsal bones. And this one right here, it kind of articulates with the tibia, and that's your talus. This is known as your ankle bone, like the ankle is your talus. And then on the, I did that so wrong because I'm losing this guy. Here we go. I lied. This is the talus. And this honker is our heel, which is the calcaneus. So talus, calcaneus. Because they're moving all over the place. All right. So from the talus, you could see a few tarsal bones before we get to the metatarsals, right? Way easier than the hand. Ready? So this one looks like a square. That's called cuboid. This one that directly comes in contact with the talus is called the navicular. So calcaneus, talus, navicular, cuboid. Then we have a lateral, intermediate, and medial cuneiforms. Lateral, intermediate, and medial cuneiforms. You want to do the foot again?
Yeah, do it one more time.
Okay, since I messed up with the talus. So talus, calcaneus, cuboid, navicular, lateral, intermediate, and medial cuneiforms. And it's your metatarsals and your phalanges. The hallux, or the first one, does not have the middle phalange. And that's it.
Yeah.